Welcome to AACR 2025. My name is John Loree. I'm a medical oncologist at BC Cancer in Vancouver, Canada, and an associate professor at the University of British Columbia. We're happy to present the results of the VICTORI study, which is a collaboration between BC Cancer and Personalis, looking at the use of the NeXT Personal in patients with resected colorectal cancer.
Yeah, I'm Emma Titmuss. I'm a bioinformatician at BC Cancer in Vancouver, and I'm going to tell you about our key findings so far. We were able to detect 100% of clinical recurrences prior to recurrence with ctDNA. Our preliminary analysis has shown a lead time of 198 days between the first detected sample with ctDNA and clinical recurrence.
That gives us more time in the clinic to hopefully intervene and help improve outcomes for patients. The fact that we've seen every single recurrence being detected with ctDNA before clinical recurrence, and the fact that we haven't seen any recurrences in patients who have surveillance samples that are negative is really impactful to say that this is a test that you can trust. And really impactfully, we see that even recurrences that are in locations such as the lung, which can be a little bit harder to detect with ctDNA, those are sites that we're still picking up with really high confidence. We're seeing every single lung recurrence being detected with ctDNA beforehand.
I was going to say, importantly, the lung recurrences were 75% of those were detected at a very ultra low level, so less than 100 parts per million.
Yeah, those results in that less than 100 parts per million range is really helpful for us to know that we're catching this at the earliest time points possible. That is hopefully going to translate into us being able to cure more patients, either with surgeries or by escalating therapy, once we find out if escalating therapy might be something that help improve clinical outcomes for patients in prospective studies.
We showed that the use of paired plasma blood draws from each patient suggests that there may be a more optimal time point to detect ctDNA post-surgery, which might be 4 weeks post-surgery. And finally, we showed that patients with low-level detections of ctDNA, less than 100 parts per million, still have a greater risk of recurrence compared to patients that are ctDNA negative. However, they have a greater lead time compared to patients that have a high-level ctDNA detection.
These results are really important to us clinically because we want to know that the tests that we're using to help guide the treatment that we have in the discussions with our patients. So knowing that 100% of recurrences are detected before clinical recurrence, that's really impactful. And also knowing the opportune time to test for ctDNA after a surgery is really impactful from this study.